You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers, or what he's calling, my first guest, full mouth reconstruction. According to him, he says your teeth are never too bad, your gums are never too bad to have the smile you've always wanted. And with us, we have Austin's go-to dentist when you want a beautiful smile, Dr. Michael Lee. Dr. Lee, welcome to the program.
Thank you. Glad to be here.
All right, now you brought a lot of photos, so we're going to try to get to as many of those as possible.
Sure.
Now, for people that don't know your practice, now today we're talking about full mouth reconstruction, but a big part of your practice is dental implant dentistry. So
Right.
who's the typical dental implant patient?
The typical dental implant patients that walk through our door is divided into two groups, Randy. One group of patients are the patients that have bleeding gums, bad breath, failing root canals. Their tooth are loose, failing root canals, failing crowns. Those are the patients that they feel like they're heading down that road for dentures.
Okay.
But they don't want dentures. Nobody wants a denture in their mouth, right? So in one short visit, we're able to remove the teeth, lightly sedate them, remove the teeth, and then place our implants in there. And they'll leave that same day with teeth fixated onto the implants, and they can eat again. They can eat their steak, their chicken, their ribs, corn on the cob, salad. They can date again. These are the patients that can date again. Some of these patients that walk in with bad breath.
Because their teeth are so bad, they tell you that they don't like to date?
When you have bad breath or your teeth are just are about to come out, you can get really, really self-conscious, right? So these are the people that haven't dated in years, or they might be in a relationship or married, but never had that love life with their significant other because they're too afraid of it.
Okay.
So these are the patients that walk in, and that same day they can walk out with brand new teeth, and the bad breath is gone.
Okay.
And they can date again and do their everyday activity. The second group of patients are the patients that are denture wearers. These are the patients that are really, really hard to get into our office. For the sole purpose, one time in their life, their teeth are falling out, failing, and the dentist said, hey, we got to take out all your teeth and give you dentures. Well, when you have dentures, you're never going to go to the dental office again because you don't have teeth.
Okay, it's a good point.
You don't have teeth. You're not going to go for your routine checkup, your routine cleanings because you don't have teeth. The only time we see these patients are when they have a sore spot and they need an adjustment or they need a reline. The dentist doesn't fit no more.
Okay.
So, and these are the patients that we can help the most because they don't realize their option at all. They've been told once that they need their teeth out, give dentures, and that's it.
Okay.
But these are the patients that we can, in our office, and the same day they come in, they'll leave with implants in their mouth and teeth fixated on. It's like their set of teeth. Right,
Okay.
that they never
All right.
had before.
All right.
Now they're able to eat again without the denture falling out, moving around. The lower ones always the ones that give the patients the most problem. For the sole purpose that it's on the bottom of the mouth, the tongue is on the bottom of the mouth. But what's the tongue always doing? It's always moving up when you're talking, smiling, laughing. Whatever you're doing, your tongue's always moving. It's knocking that denture off.
Yeah, but the upper is pretty good, right? Because it has suction, the upper denture.
You have never had a denture before, right, Randy?
No, okay.
So the upper is usually really good as far as retention goes, but what patient complains most about is they can't taste their food like they once did. They can't drink their wine and taste their wine like you once did, right? When you drink wine, there's a whole process to it. You smell it, you do the whole thing, and then you taste it a little bit, and it cleanses the palate, right? But so the patients complain about their food tasting bland over time. They haven't had good tasting food, their wine, they can't drink their wine.
So you're able to remove the palate.
We're able to remove the palate and have it less feel bulky in the front as well. So it's just a teeth that's fixated onto the implants. Now they can eat again. They can eat their steak and actually taste their steak. They can eat corn on cob, salads with cucumbers, crunchy things, right?
Good.
And they can drink their wine again. So
Now, look, I know your age. You look about 10 years younger than you really are, but you have a lot of experience. I mean, you've literally, we were talking about your bio. I mean, you've traveled all over South America from the pioneers of this.
Yes.
I mean, you said like 1,000 hours learning about full mouth reconstruction, dental implants. Is there really that much to it?
dental implants, it's very, very complex. If you have all the bone in the world, anybody can place an implant. I can teach you to place an implant right now.
Good. That's good news.
But the problem is 85% of the patients that walk into the door have teeth missing or have a narrow ridge because of genetics, right?
Okay.
We're never gonna, not most people are never gonna ever have the ideal case. So there's a lot about dental implants that we can just go over. We can just go talk about shade matching when we restore the implants,
Okay.
right? There's so much complexity to it, and it's always is always continuing to evolve. As far as technology is getting better, digital dentistry, guided surgery.
So you have all the new stuff.
We have a 3D printer in our office that prints the teeth that same day. So our patients that come
So
in,
your lab is right there on site.
our lab's right there on site. We have 2 amazing lab technicians that make the teeth while we're in surgery. So as soon as the surgery is done, they'll walk out our door with teeth in their mouth on the implants.
Okay, you know, and I was telling you in the green room, I was talking to a dentist yesterday. It's like 13 months to finally get your teeth, right? And with you, like 3 or 4 visits, and they could, I mean, if everything goes right, could have their teeth.
Yes.
Is that right?
Yes. As the world evolves in implant dentistry, I'm always learning new nuances and new techniques to make things go faster. But not only that, less morbidity. So we don't flap as much anymore because we use guided surgery. So less pain operatively afterwards. There's
Okay.
some patients that walk out of my door, the next day they're at work. I never advise that. But I usually tell them to take a couple of days off because of the swelling and everything. But some people walk out of our office this next day and go back to work.
How old can you be to do this?
There is no age limit. My oldest patient that I placed an implant on is 93 years old.
Jeez.
She walked in our office with a denture, hated that she can't eat, smile, chew, laugh, doing her everyday things for 10 years. She walked out of that office that same day with implants, teeth fixated on the implants. Now she's able to eat, smile, and do
So
it.
at 93, they're not more likely to fall out or anything like that?
They're not, the bone is just as strong as it was when you're 20, 30 years old.
Now, before we start talking about full mouth reconstruction, for people that aren't ready for a full mouth of extractions, I know you wanted to show me this one guy. So
Yes.
what are we looking at here?
This patient right here is our patient Kevin. He walked in our office. At one point in his life, he had an illness that caused, he had to go through chemotherapy, radiation, really destroyed his teeth.
Okay.
So one dentist, he walked in one dentist, they said, hey, we got to extract the teeth and give you dentures.
Okay.
He was in denture for 5 to 10 years. Didn't like him, never wore it in a day in his life. He walked in with no teeth. He went through dental offices, specialty offices, looking for dental implants. Everybody said that his bone was not strong enough or he didn't have enough bone.
Okay.
But that's just not the case in our office. We deal with limited bone on a daily basis. When he was in a different office, it's because their level of expertise was not to deal with limited bone.
Okay.
But in our office, we're able to place our implants. He walked out that day being able to go to Franklin's, the famous barbecue place in Austin,
Okay.
eating ribs, brisket, the things that he really enjoyed.
Okay, moving on to today's topic of what you call full mouth reconstruction. Give us a working definition of what that is.
Full mouth reconstruction just means that we have to rebuild their mouth back over, right?
Okay.
So at one point, their mouth is failing, teeth are broken down, but there's still some teeth that are good in there that we're going to save. We're going to try to save as many teeth as we possibly can. There's some places out there that you'll go and they'll just rip all the teeth out, place implants, and then fixate the teeth on implants. But that's the more expensive way. If we can save the natural teeth that are nice and healthy and repair what's missing or what needs to be fixed with veneers, crowns, and implants in certain areas, we can save the patients a lot more money and make them look really nice. Let me show you a few photos of my patients.
Okay.
This is the patient that came in our office and he had a tough time eating. You can see that he has bleeding gums, receding gum lines, bad breath. His teeth are kind of loose in certain areas. So some of his teeth are failing, but he had some good teeth in there. He couldn't eat a lot of things. He couldn't eat corn on the cob. He couldn't eat steak. He can't really chew down on steak.
Okay.
One of his options was a denture. That's what he originally thought coming in my office was to remove the teeth, give him a denture, but not in my office.
Okay.
We're able to save as many teeth as we can. We'll get rid of the bad ones, but then through a combination of procedures,
Okay.
we're able to,
Wow.
with a combination of procedure, we're able to restore his smile back to a nice, healthy, uniform, bright smile. You can see he had a beautiful smile before.
Yeah.
He just had a lot of things going on with it. And we're able to have him smile, eat again. He's gonna eat his steaks, his chicken, his kebabs. He loves kebabs. And so now he's back. He's back to his old self. He loves to smile, laugh, talk. He's back to his normal life. Before he was so self-conscious about it. His teeth falling out, bad breath. Now he doesn't have to worry about that. You don't worry about your teeth, do you?
Yeah, I don't really think about it.
Yeah, me either.
So
But
they do all the time? They tell you?
these patients walk into our office. Usually they talk with their lips over their teeth, or they might say 2 words. They don't talk very much. But when they leave our office, the next time we see them, They're flirting with the front desk. They're talking to our assistants. They're telling you about their kids, their grandkids. It's amazing. He's
So
back to
like the personality changes.
the personality totally changes.
Now you're a dentist,
Yes.
so you probably think like the smile is the most important thing. How important is it?
Dentists are not. If we just look at the fitness industry or the beauty industry from companies like Men's Fitness or like Cosmopolitan, if you look, they survey people, what do you find attractive in the opposite sex? Or what do you first notice about somebody when you first meet them? A smile. A smile is always in the top 1 to 3 things that they notice about somebody.
That's fair.
A smile conveys confidence. It conveys charisma, likability. For instance, if you took 2 identical twin sisters applying for the same job at the same job interview, they both have the same resume, same skill set, and they both have a gap in the middle of their teeth.
Okay.
The only difference is one was confident, smiling, had a positive attitude. The other was very subconscious, very shy about the gap in the middle. Who do you hire? Do you hire somebody that exuberates confidence, charisma, likability,
That's a good point,
has
yeah.
a positive attitude? Or do you hire somebody that when she talks, she hides her lip underneath her teeth, or she feels like she doesn't talk very much, she's very shy?
So you don't necessarily hire the one with a prettier smile, but if one has confidence and seems positive and has charisma and one doesn't, yeah.
Right. We all worked with somebody in our past that, you know, they come to work, they have a positive attitude, they got along very, very well.
Yeah.
And we all worked with somebody that was very shy, very timid. Not that we don't like them, but we just didn't relate to them. People with bad teeth are judged, right? In Hollywood, just look at Hollywood. There's dentists out there making bad teeth for actors or actresses to make them look less educated or poor.
Like if you're the poor or the villain or whatever.
Interesting. There's patients like that. And the leading man or leading actress or actress always have beautiful teeth. There's no coincidence with that. But let me tell you, in my practice, what I witness on a daily basis, we've seen these smile transformation happen on a weekly basis. We've seen patients that walk in our door that at one point in their life have bad breath, bleeding gums, unsure of themselves, in pain while eating, chewing, whatever it might be. They walk out of our office that same day of procedure with brand new teeth. They're able to eat, smile, chew.
Yeah, you have some technology in your practice that it's a face hunter, you say, that helps you show the patient what their smile is going to look like, but it also helps you design these teeth. Elaborate on that. What is that? Face hunter.
So the face hunter, it sounds like a scary word, but all it means is a face scanner. What it allows us to do is our office is fully digital. We're able to copy your face, copy your smile and your teeth. We're able to give it to our lab technicians, and he's able to basically design set teeth where they're supposed to be. It's like you being there, but without you there. So he's able to see your smile and basically put teeth where they need to be, give you that full broad smile, the pointy canines, or whatever characteristics might need it to be to make that natural, beautiful smile. Let me show you this other patient that came to our office. She had broken down teeth, bleeding gums, missing teeth, and she hated her smile. But you can see she had a beautiful, beautiful broad smile. With this face hunter, we're able to scan her face, we do combination procedures, fill in the missing spaces with dental implants, do some veneers, some crown work, and you can see how our lab technician, look at that smile. She's able to smile with confidence now. Put these photos side by side. I just want you to look at these photos side by side and look at her appearance. She looks like a young gal. We got lucky on this case. We caught it early. I bet you her next 40, 50 years, it's going to go in a different direction than what it was before.
Yeah. Because you say people, well, look, nobody likes going to the dentist, right?
Nobody.
Is that true?
Myself included.
Okay. So most people just kind of put it off and put it off and put it off. So I guess your point is that because you fixed her smile, it's going to kind of maybe her life will be a little bit different because of her self-confidence.
100%. She walked in my office. She said 2 words to me. I go, what don't you like about your smile? And they say, everything. I hate everything. Never says anything. Usually never do their hair, never did makeup. But look at her now. She's doing her hair.
Looks nice. Looks good.
She's doing makeup, and she puts herself in a fully.
And this is a full mouth reconstruction.
This is a full mouth reconstruction. We're able to save some teeth that are savable, remove the bad ones, and place implants, do veneers, crowns, and give her this broad smile. Let me show you this photo.
All right.
This patient came to our office. You can see She didn't like to smile. She had a lot of dental decay, broken down teeth, bleeding gums, bad breath. She hated her smile. You can see she barely smiled. She didn't smile at all.
That's her version of smiling.
And this is when I tell her, give me a big smile. This is her version of a big smile.
That's got to be unusual, though, when I look at that photo inside the mouth.
This is unusual because you never seen it because they always hide their teeth. But we see it all the time.
So there's people walking around that have this going on, but they just don't smile.
This is very common.
Okay.
They just don't smile. They believe in their head that they might be the worst patient I've ever seen. But
Do you hear that a lot?
I hear it all the time, but I can't help but get excited because I know.
Why do you get excited?
I can see the potential in these kind of cases. With one short visit, we're able to remove the teeth, do a combination procedure, and look at that smile. This is a totally different person. Just look at the pictures side by side.
Okay.
You can see that now. Look at that smile right there.
Yeah.
Now she's smiling a lot better, right? This is not her full smile. This is.
What do you mean?
She's smiling, but she doesn't understand how to smile just right. It's just
because she's gone so long without smiling.
She's gone so long. This is very common to her. This is very new to her. So now, by the third time somebody says, "Hey, I love your smile," it just brightens up a little bit more. It goes ear to ear a little bit more. You can see she has a beautiful, broad smile, but she's holding back a little bit. Just wait.
Can you see, like, when you're walking around Austin, can you spot people that are hiding their teeth?
Oh yeah. From a mile away, Randy.
You can see it.
You can see it from a mile away. Usually these are the patients that just walk around that usually try to hide their teeth underneath their lip, and they don't conversate very much. But it's very, very common.
And it can be changed right away.
Absolutely.
One of the things you could fix.
Absolutely.
We have time for a few more.
Sure. Let me show you this patient right here. This patient walks in our office. She's generally missing 2 front teeth, congenitally missing. And you can see how narrow that smile is. She hated that. She wanted that Hollywood broad smile.
Okay.
We're able to save her front teeth, do some veneers, some crowns, some implants.
Okay.
And look at this smile.
Very nice.
Look at side by side. You can see that she had broad smile before, but it's just her arch is very narrow. And we're able to fill in the arch with some crowns and some veneers. Just look at the after. Just look at her teeth and how it follows the lip line. It nicely follows the contour of the lip. And look at her eyes. You can see her eyes just stand out much more when her teeth are nice and bright.
So that's all by design.
This is all by design. If it was an 80-year-old male patient, I wouldn't give him the same white colored teeth I would give her.
Okay.
So everybody has a custom shade, custom teeth process making. Let me show you this next patient.
All right.
This is one of my favorite cases.
Okay.
This patient.
I think you've been saying that almost about all of them. So they're all your favorites. Good.
All the new patients are my new favorite. But this patient walks in our office.
Oh, wow.
Very anxious. Very, very anxious. Had bad dental experience when he was a kid.
Okay.
Never went to see the dentist. Hated his teeth. They're starting to rot. Now, this is the first time he's been in the dental office in years.
Okay.
He chose us because of sedation dentistry.
Okay, sedation.
So we're able to sedate him, and with the combination of procedure, save some of his teeth. They might not look like they can be saved, but some of these teeth we saved.
Okay.
With combination procedure, there's some implants, there's some crowns, and now look at his smile. Look at his smile. We can see that look at the after smile. We can see that he has a broad smile. Very nice smile. High cheekbone, his eyes, how it stands out. Now he's smiling ear to ear.
You know, this is kind of life-changing. When I say kind of, anticipating this interview, we talked on the phone, you're saying, this is life-changing. And I always feel like it's a bit of an exaggeration, but this really, you can see that people will treat this person probably a little bit differently.
Totally different patients. From the time I first meet them to the follow-up visits, they're 2 different people.
He just looks nicer, like a nicer person.
Absolutely.
In the after.
Absolutely. When you have bad teeth, something that you don't like about yourself, you have that limited belief. You might not talk to people, you might not conversate with people, you might put yourself out there. But when we're able to change their life and now they don't have that worry about their teeth and what people first notice about somebody, they're able to live their life and express to the world their full self.
Now you've said, we're talking on the phone, you said that sometimes they come in on a follow-up and you don't even recognize them. Like your team has to tell you, that's so-and-so.
Correct.
Because they're acting so different. Is that right?
Yes. It's actually kind of common. You know, when we first see these patients, they might say 2 words to us, very shy, very timid to themselves.
So their personality is totally muffled.
Totally muffled. But that same person will walk in our office during the follow-up visit, flirting with the front desk, talking.
With a skip in their step, maybe.
Well, yeah.
Let me ask you this, though. If you're missing just one tooth, why a dental implant over a bridge, like a traditional bridge?
A bridge is fine. It's been around for 30, 40, 50 plus years. They work well. But the problem with the bridge is when you make a 1-tooth problem a 3-tooth problem. You have to shave down.
What do you mean by that?
So you're missing 1 tooth. And to make a bridge, you have to shave down the tooth next to it, the 2 teeth next to it, and attach 3 teeth together.
Okay.
The problem with shaving down teeth is you're just basically doing patchwork. At some point in your life, you're expecting those teeth to fail. 30 million Americans have dentures.
Okay.
And it all starts with that one bridge. Because what happens is they start with that one bridge, now the bite's too heavy on one side, the teeth are taking too much force, 1 tooth failed. Now instead of placing that one implant and being over with, you have a 3-tooth problem. That 1 tooth fails, now it's another bridge, a long spanning bridge. Now it's a partial, now it's a full denture.
Now also, cost. You're one of the few guys I've ever seen when I went through your website this morning that you post your prices right there, which is nice.
Our prices are very, very competitive to our competitors for the sole reason that we have an in-house lab. We don't send stuff out. We're not there's no middleman in our.
You do everything right there.
We do everything right there. We have an in-house lab that makes the crowns. I place the implants. We buy our implants. We buy our stuff in bulk. So the savings that we save, we pass on to our patients. And for these big cases, we're at substantially less than our competitors, like thousands and thousands of dollars less than our competitors.
That's all posted on your website.
All posted on our website.
Okay, and financing, because insurance doesn't really cover. I mean, even the best dental insurance only covers like a couple $1,000s, right? And people are financing
They're
dental procedures?
Absolutely.
It's common?
That's very, very common. There's a third-party vendor out there that will, as long as you have a job, you have good credit,
Decent credit, okay.
you should be able to be financed.
So like every week people finance this? It's
Every
not
day.
every day.
Every day.
I guess how, like even single tooth dental implants, how they're typically done is you go to one place that does the surgery, another place that does the imaging, and then you have another dentist that puts a tooth on top. You do it all right there. So aside from convenience, what's the advantage to the patient?
The advantage to the patient is they don't have to go to multiple places. And sometimes what happens when you go to multiple places to get things done is there's a miscommunication somewhere along the line. In our office, we do everything in office. We have our lab technician making the teeth. We have our digital imaging where our assistants can take the 3D imaging, and I do the surgery. So we're able to keep everything in-house for the patient for the sole purpose that it's more convenient.
Okay.
Nobody likes to go 3 places to get
Yeah.
one thing done. And also the cost savings. We're able to pass the savings.
'Cause it's one doctor,
and
price.
one fee, one price. Most of these full mouth rehab things that I've done, I've learned after dental school. I've traveled all over the world from
You say you went to Brazil.
Brazil.
Why is that so important?
Yes, this guy.
Why would you have to go to Brazil to do this?
This guy Palimalu, he's the guy, the forefront leader of implantology.
Okay.
I went there to see his work in action, to pick up little nuances. Yes,
Okay.
I can read the book and I can see how he does things, but there are things, tips and tricks that they do that they don't publish in the book, a lot of things.
Okay.
We're able to travel to Brazil, not only Brazil, but Budapest, Dominican, to learn not just implantology, but cosmetics, digital dentistry, and able to do this for my patients, save them time, downtime, save them less pain.
You called yourself a continuation junkie or snob or something like that. I mean, you're always like
I'm
almost like
always
an
learning.
addiction to learning more. And is there that much to it? I asked you earlier, but there's that much to this.
There is a lot to this. As a dentist, we're always trying to get better. We're always trying to improve our skill sets and our learning. Not just me, but this is a culture in my office. Our lab technicians, our assistants, they all do continual education every year. It's
Okay.
because we got to get better at what we do to deliver the best product for our patient.
Now, you're big on sedation. We only have about a minute left. So
Yes.
do most people get sedated? And what levels of sedation do you offer?
Right, there's 2 groups of sedation patients. One is for the phobics. Yes, I can give them a pill the night before and get them relaxed, and then in the office, give them some nitrous or give them another pill to relax them enough so I can do the dentistry.
Okay.
We also offer IV sedation where we can sedate the patients. So IV sedation allows us to do these big cases in one visit. things that would take us 6 to 7 months to kind of treatment plan and kind of worked out, we can do in one visit because they can't hold their mouth open for that long.
And a lot, and we should mention, I guess less than like 5% of all general dentists even do sedation.
Correct.
IV sedation.
Correct.
Is that right?
Absolutely.
You couldn't do it any other way now that you're doing it?
IV sedation is easier for the patient, but it's also easier for me. IV sedation is very, very safe. We're able to monitor the patient's heart rate, blood pressure, how they're doing, their breathing, their oxygen level. And if anytime it gets low, crazy, we can reverse it. We can pull them out of it. It's just like this. If you're too sedated, I can just wake you up. I can say, Randy, wake up, and you're gonna wake up. You respond to commands, but you have no idea what's going on.
Now, is this true that some people, you might do a complete full mouth reconstruction, full mouth makeover, and they have like little memory, and some have complete amnesia of the whole process? Is that right?
Usually, they don't even know when we started or when we ended. They feel like it's 5 minutes.
Okay.
But might be there for a couple hours completing the case. But they have little recollection of what's going on. Usually, the follow-up visit, we ask them, how was it? And they said, I don't remember anything.
Good, good. Okay, so final message. And we're talking about full mouth reconstruction today, extreme smile makeovers. Let's say somebody's watching this and they have what you describe as bleeding gums, bad breath, loose teeth. Maybe they feel like they're going to head to a denture. They've heard what you had to say today, but they're still afraid, or they're still just, I don't know. What do you say to them?
Look,
But they don't like their smile at all.
Look, it's just like this. If you don't like something about yourself, either it's your hairline or you're going bald in certain areas, fix it.
Okay.
It's having a limited belief about yourself, either your teeth, your hair, whatever it might be, it can hold you back from so much more things in life. So if you don't like your smile, fix it. So I invite them in. Know your options. It's a free consultation to come see me.
Do they get to see you?
They come see me, they can see our staff, they can see our technology and what we do in our office, absolutely.
Okay, good. I want to thank you for coming on the show. Good stuff.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.